Hello, my name is Dr. Robert Leahy from New York City. I'm at the American Institute for Cognitive Therapy in New York City, and I'm a clinical professor of psychology in the psychiatry department at Weill Cornell Medical School. But today I want to speak with you about cognitive behavior therapy for depression, which is the most widely researched and effective treatment for depression. We're going to cover a number of different areas of depression, and I'm going to talk about how you can get help for it and what we can do to help our patients and ourselves. So the first thing to think about is, what do we mean by depression? And there are many different ways in which a person can manifest depression. It's not just one symptom. It's a combination of different symptoms. So there may be hundreds of ways in which somebody could qualify for the diagnosis. So when we say somebody's depressed, we want to know the specific symptoms. And what I'm going to do today is talk about how to address some of those significant symptoms. So what do we mean by depression? One, we mean that the person has a depressed mood. They're sad. They've lost interest in activities, or they don't get pleasure from things that they do. There's either a significant weight loss or weight gain. So some people lose their appetite and they lose weight, or they eat a lot and they gain weight. So it could be either one. There could be insomnia, waking up early, not being able to get through the night on sleep, or hypersomnia, sleeping quite a bit, sleeping 10, 11 hours a day. There can be either psychomotor agitation, where the person is physically moving around and agitated, or psychomotor retardation, kind of slowing down and kind of mopey. Fatigue or loss of energy, the person's tired a lot. They don't have the energy to do things and lack the motivation. There are feelings of being worthless, feelings of guilt. The inability to concentrate, can't pay attention, can't remember things. They feel indecisive, they can't make a decision. Recurrent thoughts of death or suicide, and of course the risk of suicide. And these symptoms must be present nearly every day for 2 weeks and must cause some impairment. So it's a very significant issue, depression. Lifetime, 16% of people are going to qualify for a diagnosis of depression. And it's higher rates among females than males, 24% for females, 14% for males, a significant gender difference in one study. The 12-month and lifetime prevalence for men and women also differ. So for example, women over a 12-month period, 13% will have a major depressive episode, and 26% lifetime. A significant percentage of women suffer from depression. 7.2% of men in the past month will have depression, and 14.7% in the past year or lifetime. So the other thing that's important to keep in mind is that for many people, depression is a recurrence. It happens over and over. 80% of people who have one major depressive episode will have another. And over the lifetime, people have 2 episode of depression. Over lifetime will have 7 episodes. So we have to think about depression as a cycle, as a recurrent cycle of being well for a while and then being depressed for a while, although there's some people who will go through life with a low level of depression. People who are young, the age group 18 to 29, have the highest rates of depression, followed by those age 45 to 64. The lowest rates are people between 30 and 44. So depression is something that's hitting young people now more than it is older people. It's also associated with a lot of medical conditions and other conditions. For example, people with hypertension and diabetes, myocardial infarctions and cerebral vascular disorders are more likely to be depressed. People with alcohol dependence, very, very high rates of depression, about 64% of people with alcohol abuse problems. There's high comorbidity, or people with other disorders also have depression. So many of the major disorders that we treat, such as panic disorder and agoraphobia, social anxiety disorder, generalized anxiety disorder, post-traumatic stress, and substance abuse, also have depression. And depression overlaps significantly with anxiety. 85% of patients with depression have significant anxiety, 85%. And 90% of patients with an anxiety disorder have depression. So in some ways, depression and anxiety are overlapping almost entirely. Depression affects all aspects of life. It has a devastating disorder. It's one of the leading lifetime burdens in the world. It's the leading cause of disability for people between 15 and 44. It impacts 322 million people every year worldwide. And it results in 2.7 million disability-adjusted life years. In other words, people are losing 2.7 million life years in terms of their ability to function because of depression. It impairs people at work. So 80% of depressed people report some impairment or difficulty in daily functioning, particularly at work. They lose about 5.6 hours per week of productive work. So if you have an employee who's depressed, they're going to be losing 5.6 hours a week in terms of being productive. And half of that is because they're absent or on short-term disability. So you have a lot of people who are depressed who just don't come to work, who are away. So they have increase of disability days and an increase of sick days. People who are depressed are 2.2%, 2.2 times more likely to take off sick days. So you can see the impairment from an economic point of view is quite significant. The heritability of depression varies between 37 to 66%. So let's say about 50% of depression is probably genetically determined. Suicide rates in the United States are twice as high, over twice as high as homicide rates. So it's like 47,000 people die by suicide compared to 19,000 by homicide, by murder. And rates among males are 4 times higher than females. So males are 4 times higher to die by suicide than females, although females are much more likely to be depressed. So when men attempt suicide, they try more lethal means such as hanging or gunshot. Women use overdose of drugs or cut themselves. And suicide rates have increased between 1999 to 2017 by 33%. It's higher for individuals whose parents divorced or separated or died. So the attachment model of depression has quite a significant influence. Kids who are sexually abused or have any abuse have an increased risk of depression. So we can see that childhood factors are important. There are many reasons why somebody might die by suicide. It could be genetics, could be biochemical, people with past attempts, recent events, stressful life events like the breakup of a relationship, loss of a job, impulsivity, not having the tools to deal with things. Unknown factors are important. Hopelessness, drug and alcohol abuse, access to means, or people with a gun in the household are far more likely to die by suicide. If you're the therapist, it could be your mistakes as well. But when you think about having a patient who dies by suicide, there are many, many, many causes, and you are probably not the significant reason. The Beck model, which I'll talk about in some detail today, developed by Aaron Beck in the 1960s and 70s, and over the last 50 years has gained a tremendous amount of attention. Probably the most influential model of depression ever. He talks about what he calls a negative triad, that the negative triad is a negative belief about myself, a negative belief about the future, and a negative belief about experience. So the negative triad is I have a negative belief that I'm a failure, that my future is going to be more and more failure, and that every experience I have is unrewarding and meaningless. Beck argued that the way we think about things affects our emotion and our behavior. So that's why it's called the cognitive model. And now it's been expanded, we call it the cognitive behavioral model, because we integrate behavioral interventions as well. So if you have a thought that you're a failure, and you have a thought that nothing is going to work, you become passive, you isolate yourself, and you feel depressed and sad and helpless and hopeless. Let's see how it works. Beck talks about 3 levels here. There's the core belief about myself, that I'm a loser, I'm a failure. And then we have maladaptive assumptions. So if I think I'm a loser, I might think I need everybody's approval to accept myself. Or I need to be perfect in order to accept myself, in order not to be a loser. And then we have automatic thoughts, which are thoughts that come to us spontaneously that seem reasonable. And these include certain cognitive biases like mind reading, like he thinks I'm a loser, or personalizing, oh, the reason it didn't work out is I failed, or catastrophizing, that something is awful if it happens, so if I make a mistake, it proves I'm a loser, it means that it's terrible, I'll always be a failure. Or emotional reasoning, such as I feel sad, therefore I'm a loser, and nothing will work out. So Beck's model is to try to identify these 3 levels of thinking, our core belief or our schemas, our maladaptive assumptions or our rules, and the automatic thought distortions that we have. So let's think about a negative event occurs, so a breakup in a relationship, and that's a negative event, and my personal schema or my core belief that I'm a loser, that's activated. And now I begin thinking other people think I'm a loser, or it's catastrophic, or a fortune telling that I'll never find another person, and my maladaptive assumptions are activated, such as if I don't have a relationship, I can never be happy. And then I cope in problematic ways, such as drinking or isolating myself or ruminating or becoming passive. And that just perpetuates the depression on and on and on. So rejected by the partner, I'm inadequate and unlovable. I personalize and catastrophize. If one person doesn't want me, it means I am a loser, and so forth, and then I ruminate and avoid. So this kind of cycle, a vicious cycle of depression, a negative event activates my negative views of myself and the world, and then all my automatic thought distortions are activated, and then my maladaptive assumptions, and so forth. So we're going to look at each one of these things and how to address them using cognitive behavior therapy. So what are automatic thoughts? This is a concept that Beck came up with, and it's also very similar to the kind of cognitive distortions that Albert Ellis talked about. These are thoughts that come spontaneously. So the thought that I'm a failure, or he thinks I'm a failure, this thought might come spontaneously. It seems reasonable to me if I'm depressed. It's a bias. In other words, I tend to be focused on the negative. And we can take these thoughts and categorize them as the bias or the distortion that they represent. So let's take a look at that. Let's take a look at how we would categorize automatic thoughts. So example, let's take fortune telling. I'm predicting the future. So I'll always be alone. So let's imagine you're thinking that on a regular basis, every day. I'll always be alone. Well, that'll be depressing. Or you label yourself, define myself entirely by a rigid negative description. So if I fail at one thing, it means I'm a failure. I am a failure. Again, that's going to make me depressed. Or overgeneralizing. I take one example and generalize it to everything else. I failed at this just as I fail at so many other things. So if I fail at this exam or I fail at this task, I overgeneralize it to everything else. That'll be depressing. Or I discount my positives. So whatever I do, I don't give myself credit. So if I do well on the exam, or I do well at other tasks, or if I have friends, I think that doesn't matter. Anyone could have done it. So you can see this kind of thinking just perpetuates the depression. And so the individual is locked into this biased way of thinking, and they get more and more depressed. Another part of depression and anxiety, and all of these things are also part of anxiety, is to tend to catastrophize, or things are awful. So if I have a sudden bill that I have difficulty paying, I think of it as catastrophic and I'm going to go bankrupt. So it's awful that we broke up. It's the end of the world, that kind of thing. You can see that in a lot of people going through a breakup or a separation or any kind of loss. They think of it as just absolutely awful, as opposed to it's an inconvenience or a temporary problem. A lot of depressed and anxious people do a lot of mind reading, believing that people can actually see what I'm thinking and what I'm feeling, or that they're judging me. People think I'm boring and stupid, and that'll make me anxious and depressed. Or we use our emotions to predict or interpret things. So if I have a fear of flying, I'm on the plane, and I'm anxious about flying, I'm thinking, oh, I'm feeling anxious, therefore we're going to crash. Or I feel so sad that things won't work out for me, because the evidence that things won't work out is my emotion, my sadness. Or I compare myself to people who are very successful, like people, celebrities, or people on social media. They're doing so great, they're so wealthy, they're so beautiful, I'm a nothing. You see this a lot. The more time people spend on social media, the more depressed they are. Or they have a judgment focus. I judge myself or others rather than just accepting or describing what's really going on. So I judge myself, I should have done better on the exam, whatever, rather than, oh, I got these 3 items wrong and I could improve it in the future, or other people make mistakes and I can accept it. So judgment focus is a big part of the self-criticism and the regret in depression. Or the tendency to personalize things, thinking that events are directed toward me. The project failed because I didn't do my part. It's all my fault. And this is a major part of depression. So you can see how these biased ways of thinking can add and perpetuate depression and keep a person locked into their negative self-view and the view of the world and of the future. And hopelessness is a major part of depression. When you think about hopelessness, things are not going to work out for me. It's a feeling of being trapped, no way out of my suffering. My suffering will keep on going forever. It's a major cause of suicide in the work by Beck and colleagues. And it's a major cause of depression. So for many people, depression is temporary, and for many people, breakups and losses are temporary. But for the depressed person, it just seems forever. So how can we overcome hopelessness? Well, first of all, I think it's important to normalize that hopelessness is part of depression. Just as if you have bronchitis or you have an infection, a fever might be part of the illness and it might be temporary. Second, You cannot be hopeless about the present moment. So you can't be hopeless if you're engaged in mindfulness of the present moment, if you're looking at something in front of you and describing it. Hopelessness is all about a possible future that may never exist. Ask yourself, is there any advantage in feeling hopeless? Probably not, but you might think there's an advantage that you won't be surprised and you won't get your hopes up. What would you have to change so that it's not hopeless? So thinking about hopelessness as something that, let's say you go through a breakup, what would you have to change? You're feeling lonely. So one way of changing things would be to spend time with friends or to get out and do things where you can meet other people or engage in other activities. Ask yourself, is your hopelessness becoming a self-fulfilling prophecy so that you're constantly focused on your hopelessness, and as a result, you don't do things, you stay isolated and passive, and that adds to your depression, and that becomes a self-fulfilling prophecy. So you can think about doubting your hopelessness. Well, what if I'm wrong? What if it's not hopeless? Let me even act against the hope. Let me act as if I'm not hopeless. Let me make some plans to get together with friends or engage in activities or exercise or do some problem solving or contact people. Act as if I'm not hopeless. Acting as if is a major intervention for behavioral activation. Ask myself what's not hopeless. So let's say you're going through a breakup, but maybe my work is not hopeless. Maybe my friendships are not hopeless. Maybe my activities are not hopeless. So diversifying the different possibilities in my life so that I can see I have other options. Thinking about that maybe no specific person or experience is necessary to my happiness. So what was my life like before I knew this person? What was my life like before I had that activity or that job or that possession? Have I ever felt hopeless in the past? And why did that change? So an interesting thing about hopelessness is that it does change, which seems to argue against the idea that it's hopeless. What obstacles have I overcome before? Maybe I'm more resilient than I give myself credit for. And are there techniques and medications that I have not tried? And believe me, no matter what medication you've tried, there are many other medications and combinations of medications and therapies and interventions and techniques that you could utilize to help you. Let's look at self-criticism as another symptom of depression. And how does that manifest itself? Manifests itself with regret, with guilt. People who are self-critical tend to ruminate about themselves. They have inability to take credit for positives. Oh, I'm a loser. Oh, I accomplished that. Doesn't count. So I just criticize myself and I don't praise myself. And it adds to my sense of helplessness and hopelessness. So we have to think about how we address self-criticism and how we can reverse it. And there are many techniques that we can use in cognitive therapy. Let's think about the ways in which the self-criticism is manifested. Rumination. I keep thinking over and over about how I've messed things up. Does that describe you or your patient? Or I compare myself with other people who always do better, celebrities or very wealthy people, and I don't measure up. I can't enjoy my activities because when I'm doing an activity, I keep thinking about how poorly I am in doing it or how it used to be better in the past. So I sort of discount the activity. I can't make any decisions to make a change because I don't have any confidence in myself because I criticize myself. I'm afraid of making changes because I regret things. I'll add the regret. I feel helpless because it's hard for me to do anything because I don't think anything will work out. So my self-criticism, my helplessness, and my hopelessness all go together. I isolate myself from people and I become isolated, and so I can't enjoy their company because I think I'm a burden and I have nothing to offer. I'm afraid of getting involved intimately with anybody because I'm afraid I'll get rejected if they get to know the real me. I feel sad and dejected because I can't feel good about myself. I can't accept myself. Maybe I can accept other people, but I can't accept myself. So let's think about how we can challenge and change this self-criticism so you don't have to be depressed. First, start keeping track of these negative thoughts. Write them down and even define your terms. What do you mean by a failure? Does it mean that somebody who's never succeeded in anything? Does that apply to you? You've never had any success? So write down your negative thoughts, define your terms, ask yourself, are you labeling? Are you catastrophizing? Are you discounting positives? Are you mind reading? Are you overgeneralizing? What is the evidence for and against the idea I'm a failure? So the evidence, I failed at this one task, that's evidence I'm a failure. What is the evidence I'm not a failure? That I accomplished all these other things, I have friends, I've taken other classes, I've gotten degrees, I have work or whatever, I have friends. Is there any advantage of criticizing yourself? Some people actually think if I criticize myself, I'll motivate myself. But actually what will happen is that you'll end up passive and avoidant, and you'll have low productivity. You probably won't even go to work. Do I actually really need to evaluate myself? Why don't I just simply look at what I'm doing and see what I can do and see if I can do a better job, and I can observe it and accept it. Everybody makes mistakes and will continue making mistakes, and think about that as a challenge to my self-criticism. Maybe I take things too personally, and that adds to my self-criticism. So rather than criticizing myself, I can correct myself. So if I make a mistake, I can do something differently and improve it in the future. You can use the double standard technique. Would I be so hard on somebody else who made a mistake? Why am I not so hard on other people? Why do I have a double standard? What's my core belief about myself? That I'm a failure unless I'm perfect? Am I carrying this around and not counting any of my success? What if I looked at myself along a continuum from 0 complete failure to 100% a perfect person, and I put myself somewhere along this continuum, maybe at 70 or 80%? Where would other people put me on this continuum? Rather than look at myself all or nothing, complete success, complete failure. Maybe I can humanize my mistakes and think about how I'm just like other people. I make mistakes. Maybe I can use a learning curve and think about how I can grow, how can I make my life better, rather than success and failure. Maybe I can have success by using my failures to learn how to make things better. So if I make a mistake, I can learn from the mistake, think of it as an experiment that I can learn from. So here's an example. You can defeat the self-critic, asking yourself what the negative thoughts are. Am I labeling myself? How much do I believe it from 0 to 100? So a lot of times we might start off with the belief that 90% I'm a failure. But with cognitive therapy, as we begin challenging it using the many techniques, our degree of belief changes. It becomes less and less significant. So I might go from 90% to 20%. How would I define a failure? Somebody who fails at everything, or somebody, how would I find success? Somebody who succeeds at everything? Am I defining myself in all or nothing terms? So thinking about this is a quick and easy way of looking at your negative thoughts, looking at the evidence for and against it. What percent of my behavior is inconsistent with the negative? So what percent of my behavior is not failure? What percent of my behavior is actually likable? Would I judge other people, the double standard? What would be a compassionate approach to myself to be human and caring and accepting? And how would I revise my view? I might revise my views that I'm like everybody else. I succeed and fail, and I can accept myself as I would accept other people. I might also have maladaptive assumptions. For example, this will make me depressed. I should be successful at everything I try. Why? If I'm not successful, then I'm a failure. If I'm not successful, maybe I'm a human being. If I fail, then I'm worthless or unlovable. My life is not worth living. As opposed to if I fail, I can pick myself up and improve myself and make today a better day. I can think of failure as something that's tolerable rather than intolerable. I can accept failure as part of the experiments and experiences of everyday life. Or the idea I should get the approval of everyone. These assumptions only make us more and more depressed and anxious. So think about the assumptions that you have and how you can challenge them using the cognitive therapy techniques. You can think about the assumptions you have that add to your anxiety and your worry. I should always keep my eye out for any anxiety, for any problems that I have. If I let my guard down, something bad will happen. This kind of way of thinking, these kinds of assumptions, only make us more and more anxious and depressed. And the good thing is that we can change this. We can use our cognitive therapy techniques to modify each one of these. Sometimes we discount our positives. Anyone can do that, really. But everyone is not doing what you can do that is positive. Think about it. There are 8 billion people in the world. Is everybody doing the positives that you do? Why not give yourself credit? If you don't give yourself credit for your positives, you only have negatives. That's like having a bank account. You only count the withdrawals. You don't count the deposits. So give yourself credit for what you do, just as you would give you would give other people credit for what they do. Maybe you think about things in an all or nothing way. Again, this is a distortion. Of course you've done some things right. You don't have to be perfect to give yourself credit for your positives. So this kind of all or nothing thinking that keeps you from recognizing that you do positives keeps you depressed, and you can change it by using all the information, positive, neutral, and negative. Labeling, only a loser does as bad as I did. Again, normalizing, humanizing yourself. All of us make mistakes, which means in our thinking, we are all losers. So are we all losers? I don't think so. Very smart and successful people, very worthwhile people make mistakes every day. Ask around. Talk to successful people. Talk to people that you admire and ask them if they ever make mistakes. The difference is that they learn from their mistakes and they accept it. So it's not like you have to go out and be perfect and never make mistakes. You can make mistakes, but if you accept it and learn from them like successful people do, then you don't have to be depressed. Or you might overgeneralize. You might say, I'm always screwing up. Really? You can think about all the ways in which you've done things that are right and things that have worked out. Has anything been positive? What would your best friend say to you on your behalf? What advice would your friend do? When you say you're always screwing up, would your friend think that's what you're a complete screw up, you never do anything right? Or would they say, hey, wait a second, you've done this right, I'm your friend, you have other friends, you've done something good at work and school and other things, you're a decent person. Look at yourself from the point of view of a fair-minded person would look at you. Another part of depression is building motivation to change. So one of the things that we see with depressed people is they say, I can't get myself to do anything. They withdraw, and therefore they have fewer rewarding activities. They isolate themselves. They become passive. Remember that some depressed people sleep a lot. They become preoccupied with themselves. They begin ruminating. I'm a loser. I'm a failure. I'm ugly. I'm unlovable. And they lose their sense of any competence, and they withdraw more. So we have to change that. And the good news is that the behavioral activation approach is very, very useful. So what is behavioral activation? It's increasing your activity level, so you have more rewarding experiences. So think about identifying your long-term goals. I'll tell you about myself. I grew up in poverty. My parents were divorced. My mother raised my brother and me. We were very poor. I said to myself when I'm 12 years old, I'm going to get out of poverty and I'm going to go to college. That was my long-term goal. I set aside time. I had specific behaviors every day. I had a plan. Set aside time for reading and learning vocabulary. I assumed that the school I was going to was not going to provide me with adequate education, so I had my own plan. I actually kept track of what I read and what I did. I had a little notebook and I kept track of it every day. I'm willing to set aside time to do these things, time away from my friends or television to get my work done. I assigned myself these activities. I was willing to delay gratification, willing to do things now so that my life could be better in the future. That's what I thought I wanted to do, and I did it. And as a result, I got into Yale University. So let's look at the excuses that we all have. I don't really want to do it. Do you always have to do what you want to do? You can choose to do what you don't want to do. I mean, my view of it is do what you have to do in order to get what you want to get. This idea that I shouldn't have to do things I don't want to do is absurd. I mean, that's childish. Actually, being able to do things that are unpleasant is a way of building resilience, is a way of building the capability of overcoming obstacles. Think about, maybe predict how unpleasant you think it's going to be from 0 to 100, and then do it. Actually do the activity, like exercise. Maybe you think it's going to be like 90% unpleasant, but you actually do the exercise and maybe it's only 40% unpleasant. So maybe you're over-predicting. But maybe it's somewhat unpleasant, but you feel like you're making progress toward a goal. And that's the whole thing. Some people have the idea that I have to be ready to do something. Haven't you done things in the past you weren't ready to do? Haven't you, like taking exams or working out or getting your work done or meeting new people? You don't have to be ready to get things done. You have to do them. You have to choose to do them. So it doesn't sound like the real world to me if you think you have to feel like doing things. The real world is doing things a lot of the time that you don't want to do. You can go to the health club every day, even if you feel lazy, and exercise anyway. So if you go to the health club every day for a year, and every day you don't feel like going, but you go anywhere, you're going to make progress. Making progress sometimes is doing what you don't want to do over and over and over again, so you can feel more effective. And that's a great way to overcome depression. So you can think about your purpose, and my purpose was to go to college and not be poor for the rest of my life. So I chose certain activities, like studying hard and scheduling things. I put aside the behavior, and then I experienced the consequence of doing better. That's a way of getting out of depression. It's a way of being empowered and doing things that are uncomfortable, what I call successful discomfort. So we can build motivation by relying on habits and not on feelings. A lot of people, I have to feel like it. No, you don't. Make it a habit. So my habit is to exercise every morning, no matter what I feel like doing. Identify your goals, maybe to be in shape or do better at school or do better at your job. Ask yourself the kind of person that you want to be. Do you want to be somebody who has success, who has friends, who has relationships, or do you want to be depressed? What did you do when you were not depressed? A lot of times that's really the prescription. Why don't you start doing what you did when you were not depressed, even if you don't feel like it? Set specific goals every day and every week and every month, what you want to do. Plan and predict your pleasure and how effective you're going to be. So if I go to the gym and I work out, maybe I predict the pleasure will be 0 and I won't feel at all effective. But I find out maybe I get a 3 or 4 out of pleasure, and I feel maybe a 7 out of 10 on feeling effective. And then sample the menu. Have a list of rewarding activities or pleasurable activities that you can put together based on things you did in the past, or maybe with your friend putting together a list of ideas of things that could be pleasurable or give you a sense of growth. So look at your excuses. Do what you don't want to do, because that's going to help you make progress and build resilience. Act against your thought that you shouldn't have to do it. Choose your purpose. Make clear what your goals are and your values. Examine the costs and benefits, short-term and long-term. So the short-term benefit of going to the gym is very little. The long-term benefit, if I keep going, could be very great. Take action to create motivation. Action sometimes creates motivation. In other words, if you work out over and over, you eventually become motivated. You become energized. So maybe action creates the progress that you want to do. And don't expect an immediate payoff. I like to think of behavior as an investment, where the costs are upfront. How do we deal with rumination? Well, rumination is, I can't get this out of my mind. I keep thinking of it over and over and over. I can't understand why that happened. I wonder why did this happen to me? I can't believe it happened. I can't get my mind off of it, how terrible it is. It's so unfair, why me? These are repeated thoughts that you have over and over and over that just keep you in depression. And what we know is that depression is made worse with rumination. So an event occurs and you think it's unpleasant and unfair, and you think everything should make sense. People should act a certain way. Life should, I don't understand. And my strategy now is to ruminate. If I keep thinking about it, I'll finally understand. And you might even think that rumination is solving the problem, as opposed to making the problem worse. And your rumination does not provide certainty, does not provide fairness. It just keeps you stuck, and it leaves you withdrawing and inactivity, and a negative focus on feelings and increased depression. What we know about rumination is that it's one of the best predictors of depression. It keeps you stuck in negativity. So some of the behavioral activation stuff is a good antidote to rumination. But there are also some techniques that have been used with metacognitive therapy, with Adrian Wells's work, and others, with Watson in England, on how to overcome rumination. So ask yourself, what do you think you're going to get out of rumination? How does it make sense to you? Do you really think it's going to solve a problem? Do you think you're going to get fairness? Do you think it's going to make everything clear? Has it been working? One thing we need to think about is that in real life, we have to learn to tolerate uncertainty. So a lot of times, worry, where we think about the future over and over, is going to be bad. We think, I have to have certainty in order to feel comfortable. There is no certainty in an uncertain world. So we have to think about tolerating certainty. And tolerating certainty means that, look at everything else in my life that I have uncertainty. Why do I tolerate that? Sometimes we have difficulty accepting conflicting information. How can this person who I thought was nice do such a negative thing? We think everything should be in one way. That's not the way the world is. People are complicated. Is rumination really going to solve my problem? Am I going to be better off if I keep ruminating? Has it worked? You can set a time limit to your rumination. Set aside time. I could call it rumination time or worry time. Set aside 20 minutes a day where you ruminate, and we can start using some of our techniques. You might think that that's impossible, but I found with many of my patients, they're able to get some benefit by setting aside an appointment with a rumination. I'll get around to it at 2 o'clock in the afternoon for 20 minutes and focus, and I'll put things off to later. That frees up the rest of the time. We can shift attention. Rather than ruminate, I can describe the things in the room, the painting in front of me, a picture over there, outside looking at the buildings in New York City. I can shift my attention What if I accepted reality as a given? So given that this happened, maybe it was unfair or unpleasant, I'm going to accept it and move on from there. Why does the past always have to make sense? Why do I always have to get everything clear? Why do I have to have an answer? Is having the answer necessary? Let's say you're feeling lonely, whatever, you went through a breakup. Why did she break up with me, or why did he break up with me? Even if you had the answer, you're still alone. Maybe the solution is to be with other people rather than ruminate. Practicing mindfulness is a great way of setting aside from your rumination. You can accept the thought that you have, accept that you don't know the answer for the breakup or why something happened or why you felt so uncomfortable. You can accept it, the intrusive thought. It's okay, it's an intrusive thought. I notice it, I accept it, but then take action in the real world and become active in doing rewarding things and challenging things, meeting new people, solving real problems. I like to think about using imagery for our intrusive thoughts, whether it's rumination about things that happened in the past or worries that we have in the future. And so, for example, there are 4 different imageries that I'll talk about. Trains in the station, clouds in the sky, thought balloon, telemarketing call. These are concepts or techniques that are derived from metacognitive therapy, where we basically are going to notice the ruminative thought and let it go. So let's take a look at using these metaphors for intrusive thought. Let's take trains in the station. Let's imagine you're at a train station, but there's only one train that you really want to get on, but there are all these other trains coming in, this train and this train, but you're not going to get on these trains. These are your intrusive ruminations or your worries. Those are trains in the station. I see the trains, but they're not my train. They're not going to make my life better. So those rumination trains, they can come and go. I'm going to let them go. A lot of people like using clouds in the sky. If you look up in the sky, you can see clouds wherever you are during the day. Think about your thoughts as clouds that drift away. Practice that kind of mindfulness. Observe the clouds and let it go. Let that cloud go. It drifts away. It drifts away. Your rumination, your worries are drifting away. That's a mindful detachment. Or think about a thought balloon. Your rumination or your worry is in that balloon, and you're tugging with it, and the wind is pulling the balloon. The wind is trying to pull it away. You let the balloon go, and your rumination, your worries go up in that thought balloon. You let that go. Again, mindful detachment. You let it go, letting it go, watching it go, drifting away. My thought is drifting away. Or you can think about your rumination or your worry as a telemarketing call. You hear the phone ring. It says spam call, telemarketing call. You don't pick it up and have a conversation. You just let it go, and it rings and rings and rings, but you're going to get on with something else. You hear it in the background, and it means nothing. That's the rumination or the worry telemarketing call. Get on with your real life. So these are some techniques that I hope you'll find useful for yourself or for your clients. Looking at the automatic thought distortions, the maladaptive assumptions, your core beliefs or schemas, the Beck cognitive model, the behavioral activation model, the metacognitive model of worry and rumination, building motivation, overcoming self-criticism, making your life better, building acceptance, having more rewarding activities, overcoming isolation and passivity. There's a lot of work to do, a lot of techniques that we can use, and I hope this find useful. Thank you so much.